As the year 2014 comes to a close, Health News brings you a recap of some of the events in Nigeria's health sector during the year. Welcome to the program. I am Yomi Otaigbe. At the beginning of the year, threats of industrial action and a few days of warning strike by various healthcare workers set the tone for what later transformed into months of indefinite strikes in Nigeria's health sector. The bone of contention ranges from agitations for better welfare package and working conditions to superiority issues among health workers. The first indefinite strike was called by the Nigerian Medical Association.
The emergency delegates meeting of the Nigerian Medical Association that met last Saturday has directed all doctors in the country to down tools as from 0010 hours of the 1st of July 2014.
The ripple effect of this directive by the president of the Nigerian Medical Association, Dr. Kayode Obembe, is now being felt in public hospitals in most parts of Nigeria. From the north-central states of Kogi and Niger to the National Hospital in Abuja, patients seeking medical services in government hospitals are either receiving skeletal services or are being outrightly turned back.
To my greatest surprise, there was somebody who said he's a HOD, though I did not know his name, said he will just come and let us know that we should just go, that doctors are on strike. So we are just here.
The management of issue has met. We also resolved that we put all machineries in place to make sure that our patients in the wards are well taken care of. And so we might not admit new patients, but we also attend to emergency cases in National Hospital.
Moving down to Ogun State, precisely at the Federal Medical Center Idiaba in Abeokuta, the strike action has paralyzed activities. Here at the General Hospital Bagada in Lagos, southwest Nigeria, the patients are left in the hands of nurses and a few consultants on duty. The nurses here at the emergency room are doing what they can to salvage the situation, while other patients wear long faces, not knowing when it will be their turn. For now, they have to wait while the doctors sort out their 24-point demands with the federal government. Top 5 issues the doctors want addressed immediately include the appointment of Deputy Chairman Medical Advisory Committee, DMARCs, for teaching hospitals and federal medical centers. The doctors are opposed to the appointment of directors in the hospitals. These, they say, would distort the chain of command. The NMA demands that grade level 12 in the health sector must be skipped for medical doctors. The NMA also declared with emphasis that if non-doctor consultants are appointed, it will lead to chaos in the health sector, and so this should not happen. The association said relativity in the health sector is also sacrosanct, demanding the immediate implementation of the January 3, 2014 circular.
Strikes here and there, most times they do that for getting increments in their pay. But fortunately, I heard the issue is not even that now. It's like an administrative issue. Why now? Why now when everybody should join hands to see how they can save the lives of people? Why is this a time we want to start losing people? We have people in the hospital, we have children, we have women, waiting for them to care for them. This is not the time.
For me, strike for medicals, hospital, and it's not good because these are people that are on essential duty, to save lives.
I wouldn't say they shouldn't go on strike because what they are fighting for, there must be something.
It's the patients and their family members that are at the receiving end of a seeming superiority tussle in the health sector. Everyone is looking in the direction of the federal government, represented here by the Federal Ministry of Health and the striking doctors, to see to the end of not just this strike, but incessant strikes by healthcare professionals in Nigeria. As the strike continues, the then Minister of Health, Professor Onyebuchichukwu, views NMA's action as unfortunate and unnecessary.
The federal government is not unaware of the suffering and hardship that the strike action has imposed on the generality of Nigerians, but wish to reassure all Nigerians that not only does the government disapprove of this particular strike, which is totally unnecessary, but has made every effort to negotiate with the NMA and ensure the immediate resumption of services in government hospitals. Government has also, within its limits, provided within its hospitals mechanisms and opportunities to enable those that require urgent care to be taken care of. While the action of the NMA is regrettable, government is doing everything possible to mitigate the effects of this strike on Nigerians. As I speak to you, the government has made its own side of the MOU totally, and it is expected that the members of the NMA will from today begin to respond and attend to all emergency cases in public hospitals in the spirit of this understanding. The MOU also stipulates that the NMA will call its emergency delegates meeting on Monday, 7 July 2014, with a view to also calling off the strike completely.